Running injuries learning objectives. 1. Describe 13 ways to avoid common running injuries. 2. Explain ways to manage and recover from injuries caused by running. 3. Name and describe the causes, symptoms, and treatment for 7 common running injuries. At least half of all runners deal with at least one injury per year, and 25% of runners are injured at any given time. The longer someone is a runner, the more likely he or she is to get injured. It's an understatement to say that runners hate to be injured. It affects their lives in innumerable ways, none of which seem positive at the time it's happening. When runners lose their ability to run because of injury, it's easy to feel helpless, vulnerable, and even scared because the fitness and vibrancy they get from running is taken away. As a running coach, it is your job to help running clients prevent injury and overcome any injuries they may encounter. Perhaps the biggest myth about running is that it somehow messes up your knees for life. Why would an activity that humans evolved to do be bad for our bodies? If the activity were harmful to your knees, evolution would have eliminated the ability to run a long time ago because only traits that confer an advantage survive. People assume that pounding the ground with your legs with so much force must be jarring to your joints. But if you run correctly, you shouldn't be pounding the ground. You should be rolling through each step, skimming the ground like a pebble on the water, with your body in perfect alignment and your feet landing underneath your hips. Running shouldn't be a jarring activity. When done right, it's smooth and fluid. Also, the research simply doesn't support that running is bad for your knees. People who run have no greater incidence of joint problems or osteoarthritis than people who don't run. If you have a family history of joint degeneration, for example, if both your parents have had knee replacements, or if you already have knee problems when you move a certain way or do certain activities, running can bring that genetic predisposition or those latent issues to the forefront. But running per se isn't the underlying cause of your joint problems. If you have healthy knees, running isn't bad for them. There's no good reason why so many runners should get injured. Yet it happens all the time, mostly because so many runners don't train intelligently or they follow programs that are faulty in design. Every time a runner's foot lands on the ground, their leg absorbs 2 to 3 times their body weight. Multiply that by the number of steps a runner takes to run 5 miles and multiply that by how many times he runs each week, and you get an idea of how much stress a runner's anatomy must deal with. The human body is great at adapting to stress, but only when that stress is applied in small doses and adequate time is given to recover from that stress before another stress is applied. The main reason why running injuries happen is because the physical stress is too much for the body to handle at that time. That stress can be due to biomechanical factors that cause excessive movement of the foot when landing on the ground and / or to training factors. Either case can cause too much force, a higher frequency of force, or a longer duration of force, which negatively impacts the joints or tissues. The causes of running injuries can be divided into intrinsic factors, which are personal, and extrinsic factors, which are related to training and environment. Intrinsic factors are characteristics specific to the runner and include previous injury. Runners with previous injury, especially in the past year, have an increased risk for another one. Already having an injury shows that that body part is vulnerable. To prevent a previous injury from returning, the underlying cause of the previous injury must be addressed rather than the injury simply being treated. Lack of running experience. New runners have a greater risk for injuries because they're not yet used to the stress of running. Running in and of itself develops the durability that makes the body resistant to running-related injuries. Sex. Female runners only have a greater risk of injury than male runners under conditions of low estrogen, such as irregular or absent menstrual cycles and menopause. Since estrogen has the biggest impact on bone health in women, any condition that reduces estrogen increase is risk of bone injuries. Bone density. Low bone density, which can occur in women with low estrogen increase, is the risk of stress fractures. Dense bones help runners withstand the large ground reaction forces associated with running. Foot type. Flat feet that do not have a rigid arch and pronate excessively while running can cause injuries. Hip/gluteal muscle activity. Cross-sectional studies show that duration of hip gluteus medius muscle activity is associated with patellofemoral pain syndrome knee pain. runners with knee pain tend to have decreased hip strength compared to runners without knee pain. Also, runners with iliotibial band friction syndrome have greater adduction of hip and greater internal rotation of the knee when the foot lands on the ground, which suggests that weak hips/glutes may play a role. However, prospective studies that track runners over time to examine factors that result in injuries have shown that hip muscle weakness does not cause these injuries. So there may be an association between weak hips/glutes and running injuries, but it doesn't seem to be the cause. ISSA running technique and programming 109, intrinsic factors that affect how and why some runners become injured that are related to the runner themselves. Extrinsic factors that affect how and why some runners become injured that are related to their training and training environment. Mileage. Weekly mileage is the greatest predictor of injury risk. It's hard to say exactly how many miles per week increase is the risk of injury because that's an individual matter. Some runners may be able to handle 50 miles per week, while others may get injured with 30. Some runners called Olympians can run more than 100 miles per week and not get injured. On average, the risk of getting injured is 2 to 3 times greater when running at least 40 miles per week. Intensity, running at a faster pace, like during interval workouts, is a greater stress on the legs. Shoes. Running shoes have specific combinations of support and stability designed for different running gaits. Running in the wrong shoes can adversely affect lower extremity alignment, making runners more susceptible to injury. A cushioning shoe isn't a good choice for an overpronator who needs a shoe that offers more stability. Although shoes play a role in injury prevention because they influence the dispersion of forces and control the position of a runner's foot when it lands on the ground, shoes are not usually the real reason why runners get injured unless they're running in the wrong type of shoes. Your skeleton doesn't care which shoes you wear. The major reactions that occur when you run are to your muscles, not your bones, so if you change the type of shoe you run in, what change is how the muscles work. Research from the University of Calgary during which the movement of the skeleton while running with or without orthotics and with or without shoes was determined by placing special, marked screws into the heel bone, tibia, and femur, has shown that the effect you produce on the skeleton when you run is very minimal. So if you ever get a bone injury from running, don't blame your shoes. Accidents, tripping/falling while running or getting hit by a car can cause a variety of injuries. For all running-related injuries, focus the treatment on the underlying cause rather than on the symptoms. If you focus only on the symptoms, the runner may feel better, but he or she won't eliminate the reason why the injury happened in the first place, and that can result in getting injured again. Although runners are less likely to become injured if they follow the advice in this course, sometimes they can get injured without any apparent reason and no matter how careful they are. In this manual are the secrets of how to get darn close to completely preventing running injuries, followed by the causes, symptoms, and treatment for the most common ones just in case. Secrets of running injury prevention. Secret #1, Train Smart. To train smart, runners must learn how to optimize their training and train at more effective levels of effort to get the best results. The goal of training is to obtain the greatest benefit while incurring the least amount of stress, so runners should run as slow as they can to meet the purpose of the workout. If running at 8-minute mile pace meets the purpose of the workout, there's no reason to run at 7:45 pace. Training smart also means progressing at the right rate, never increasing the volume, intensity, or volume of intensity too quickly. As a running coach, you should create a systematic, progressive training plan, with each cycle of training building on what came before so that the entire program is seamless. Secret #2, increase weekly running mileage very slowly and spread it out over the whole week. From a training standpoint, how quickly weekly mileage is increased probably has the greatest impact on whether a runner gets injured. The slower the weekly mileage is increased, the less chance of injury. To safely increase running mileage, add only about a mile per day of running so that the stress is spread around. For example, if the runner currently runs 20 miles in 4 days per week, he or she should run no more than 24 miles next week by adding 1 mile to each of the 4 days. He or she should not run 4 miles next week by adding all 4 miles to only 1 day of running. Many books and articles quote the 10% rule of increasing mileage, but there's nothing special about 10%, and runners can often increase by more than that if they're smart about how they do it. Trained runners may be able to get away with adding more miles more quickly, especially if they have experience running more miles. For example, if someone has run 60 miles per week in the recent past, and now they're training for their 5th marathon and building up their mileage, they don't necessarily have to go from 40 to 45 to 50 to 55 to 60 miles per week over a couple of months. They may be able to make bigger jumps in mileage because their legs already have experience running 60 miles per week. However, if 60 miles per week is brand new territory for them, then they may need to increase their mileage in smaller increments. Secret #3, don't increase your running mileage every week. New runners, older runners, or runners who are prone to injury should run the same mileage for 3 to 4 weeks before increasing it. A runner's legs should be given a chance to fully absorb, adapt, and habituate to the workload before increasing the workload. 20 miles per week should become a normal experience for the body before increasing to 25 miles per week, and that takes time. Secret #4, don't increase the distance of your long run every week. Just like with weekly mileage, the same is true for long runs. This is especially important if the runner is entering uncharted territory with his or her long run's I.E. He or she has never run that distance before. The runner should repeat the same long run for a few weeks before running longer. A 9-mile run should become normal before trying to run 10 miles. Most marathon and half marathon training programs and groups make the costly mistake of ramping up the long run too quickly because their training programs are only 5 to 6 months long, so they increase the distance of the long run every week throughout their programs until it's time to taper 2 to 3 weeks before the race. That's a good way for new or recreational runners to get injured, as they're increasing the stress week after week after week. If someone is running her first marathon or half marathon, and she's starting from a short-ish long run, she needs to give herself much longer than 5 or 6 months to prepare without risk of injury. Secret #5, don't make the long run so long. To avoid injury, don't make the long run such a large percentage of the weekly running distance. Ideally, the long run shouldn't be more than about a third of the weekly mileage. So if the long run is 10 miles, the weekly mileage should be at least 30 miles. If the long run is 20 miles, the weekly mileage should be at least 60 miles. Many runners don't run that much, so you need to be creative when designing the training program so that the runner doesn't accumulate so much stress in one run. Don't misunderstand, the long run should be stressful. After all, the person is running for a long time and trying to make herself exhausted so their body adapts. However, the long run shouldn't be so much more stressful than any other run during the week. It's always better to spread the stress around, to reduce the injury risk associated with a long run being much more than a third of the weekly mileage, which may happen when training for a marathon and not running big weekly mileage. The runner should do a mid-week medium long run that's about 65 to 75% of the length or duration of the long run. Secret #6, take a step back before taking 2 steps forward. Every few weeks, decrease the weekly mileage by about a third for 1 recovery week to give the legs a chance to absorb and respond to the training. For example, if someone has run 30 miles per week for the last 3 weeks, he or she should back off to 20 miles for 1 week before increasing above 30 miles for the next week. They'll notice the difference it makes in how his legs feel, and they'll come into a greater workload week on fresher legs. Secret #7, never increase weekly mileage and intensity of workouts at the same time. When runners begin to include interval training and speed work into their program, either reduce the overall mileage for the week or maintain the mileage from where it was prior to adding the interval training or speed work. The legs can handle only so much stress at once. Trying to increase the weekly running distance while also increasing the intensity of the workouts is too much for most runners to handle. Secret #8, alternate hard days and easy days. For every hard day of running, follow it with at least 1 day of easy running, and make sure easy days are truly easy. Most runners shouldn't run hard more than 2 to 3 days per week. Secret #9, run very easy on easy days. The biggest mistake runners make is running too fast on their easy days. By doing so, they add unnecessary stress to their legs without any extra benefit, and they won't be able to run as much quality on their harder days. Easy runs should feel gentle and allow runners to hold a conversation. Secret #10, each runner should train appropriately for him or her. Secret #11, get adequate recovery. Secret #12, reduce excessive overpronation. Because excessive overpronation when the foot rolls inward too much upon landing on the ground is a common cause of many running-related injuries, try to reduce any pronation that is more than normal/moderate. Runners should wear the correct type of shoes for their feet and running mechanics E.G. Cushioning/neutral, stability, or motion control limit running on cambered roads, especially in the gutter near the curb, which increase ankle pronation of the outside foot and strengthen their calves, which helps stabilize the lower leg when it lands on the ground. Secret #13, balance strength imbalances. When muscles are weak, other muscles and tendons must absorb more of the stress. Evaluate any areas of muscle strength imbalance and strengthen the weaker muscles. Specific, targeted strength training can help eliminate muscle strength imbalances and thus protect tendons and joints from injury. This is especially true for runners who have little to no running experience, who may or even likely be weak because of years of being sedentary. The two most important areas to focus strength training to prevent running-related injuries are hip stabilizers and ankle stabilizers. Eccentric strength training, during which muscles are forced to lengthen under tension, is very effective for increasing muscle strength. Returning from and managing injuries, although you always want to prevent running injuries from occurring, sometimes they still happen. If an injury does occur, try to discern the cause of the injury and learn from it so you can prevent it from occurring again. When your client returns to running after being injured, don't pick up from where he or she left off. Take a couple steps back in order to take 100 steps forward. You don't necessarily need to start all the way at the beginning of the training plan unless your client is a beginner runner. The nature of the injury, for example, Achilles tendinitis/tendinosis vs. stress fracture, and how long your client was not running determines your starting point. If up to a week of running was missed, it's okay to start almost where the client was before, since not much fitness is lost in that short amount of time, and the injury couldn't have been that serious if it only interrupted training for up to 1 week. If, however, many weeks or months is missed, that means the injury was serious and a significant amount of fitness is lost. In this case, go back to a much earlier part of your training plan to find an appropriate place to start, and depending on the specific injury, you may need to add rehab exercises to the training plan. For example, if a runner is about to start running again after a stress fracture, add some exercises that promote stronger bones, such as 2-legged and 1-legged hops in multiple planes of movement to increase the strength of the bone. If you determined that poor or suboptimal running technique contributed to the injury, add running technique drills to ingrain optimal technique when the runner resumes training. Once you have found an appropriate place to resume training, change your plan based on what you think may have contributed to the cause of the injury. Here's a hint: most running injuries occur because of too rapid of an increase in training volume and or intensity, or not enough time between harder workouts. Most injuries don't require a complete cessation of running. Of all the running injuries to be covered, only a stress fracture requires the runner to completely stop running. Managing training around an injury can be tricky, but you are now an expert having taken this certification course, so you can handle the challenge. If your client starts to feel something brewing, like an Achilles tendon starting to feel sore, nip it in the bud as quickly as you can and change the training plan accordingly, slowing the training progression or pausing until things feel better. Common running injuries: patellofemoral pain syndrome. Patellofemoral pain syndrome is the fancy medical term for knee pain. When you extend and bend your knee to straighten and flex your leg, your patella knee bone glides back and forth within a groove in the end of your femur thigh bone. The patella and groove in the femur comprise the patellofemoral joint. Figure 6.1 patellar tendon and the knee. The patellofemoral joint is stabilized by soft tissue structures that control movement of the patella within the groove, a function called patellar tracking. Any alterations in normal patellar tracking can cause patellofemoral pain syndrome. Cause is strength imbalance in stabilizing muscles, suboptimal lower leg running mechanics, increased stress across the patellofemoral joint, hip muscle weakness, excessive or insufficient pronation, anatomical factors, such as hip width and angle of the femur meeting, the patella Q-angle symptoms, pain behind, below, or around your patella. The pain usually comes on gradually and gets worse when running or when walking up or down stairs. Treatment: muscle strengthening. Strengthen the muscles that support your knee to reduce patella tracking, including quadriceps, hamstrings, hips, and glutes. Orthotics. Orthotics help stabilize the foot when running and reduce impact. They're helpful for runners who severely overpronate their foot rolls inward excessively upon landing or underpronate their foot doesn't roll inward enough upon landing to adequately absorb shock. Knee braces, knee sleeves, and patellar straps. Putting something around the knee to stabilize it when running may provide some relief of the symptoms. Reduction of running volume. Runners may need to back off on their running until the pain subsides. Discontinuation of hill running, because hill running, especially downhill running, puts extra stress on the knees. Runners should stay away from hills until the pain subsides. Iliotibial band friction syndrome. Iliotibial band friction syndrome is the most common cause of pain on the lateral outside of the knee among runners. The iliotibial band is a sheath of connective tissue that runs down the length of the thigh, from the hip to just below the knee. The iliotibial band assists with outward movement of the thigh and stabilizes the lateral part of the knee. With iliotibial band friction syndrome, the iliotibial band repeatedly rubs up against the outside of the knee, causing friction and pain. Figure 6.2 iliotibial band cause is excessive or abrupt increase is in running mileage, pre-existing iliotibial band tightness, too much downhill running, too much unidirectional running around a track, too much running on cambered roads, which causes excessive overpronation, stiff shoes that limit pronation, high, arched feet that don't adequately pronate, which transfers the shock of landing to other parts of the leg, hip and gluteal muscle weakness, running mechanics. Specifically, change is in knee flexion at heel, strike and internal rotation of the leg, symptoms: stretching. Lie on your back with both legs out straight. Put the foot of the injured leg in the loop of a rope, positioning the rope between your heel and the ball of your foot. Wrap the rope around the outside of your ankle so that its ends are on the inside. Contract your adductors, inner thigh muscles, and sweep the leg across your body, passing just above your other leg. Keep your knee locked. When you feel tension in your leg, gently pull on the rope to extend the range of the stretch. Hold the stretch for 1 to 2 seconds, return to the starting position, and repeat 5 to 10 times. To stretch the iliotibial band while standing, lean against a wall with the injured leg away from the wall. Put the injured leg behind the opposite leg. Lean into the wall away from the injured leg until you feel a stretch along the iliotibial band. Ice. Fill a styrofoam cup with water and freeze it. Tear away some of the foam from the top so the ice protrudes. Massage the ice over the injured area using a circular motion for 10 minutes. Repeat 3 to 4 times per day. Rest. If the pain is severe, running may need to be cut back or stopped until the pain subsides. Foam rolling. Lie on the side of the injured leg with a foam roller directly underneath the iliotibial band. Roll up and down on the foam roller to massage the area. Foam rolling helps loosen the iliotibial band and the surrounding tissues. Muscle strengthening. Strengthen the muscles that control the leg when it first lands on the ground, including the hips and glutes. Achilles tendonitis and tendinosis. Achilles tendonitis and tendinosis are very common injuries in runners. The Achilles tendon attaches the two calf muscles, gastrocnemius and soleus, to the heel. Named after the Greek god Achilles for its strength, the Achilles tendon is the thickest and strongest tendon in the body. Because of its location and the stress it bears from running, runners have 30 times the risk of developing Achilles tendonitis and tendinosis compared to people who don't run. An injury to the Achilles tendon occurs when the amount of stress on the tendon exceeds the ability of the tendon to adapt to the load. Figure 6.3 Achilles tendon cause is inappropriate increases in mileage, too much interval training, hill running, inadequate recovery time between workouts, calf weakness, excessive overpronation, poor calf muscle flexibility. Symptoms for the First few days of the onset of Achilles tendonitis, there may be inflammation. Itis means inflammation, but any pain is the result of a degenerative process, tendinosis, in the collagen fibers that make up the tendon. Over time, the fibers may weaken, leading to a partial tearing of the tendon. Achilles tendonitis and tendinosis are very easy to diagnose. The only symptom is a gradual onset of pain on the Achilles tendon. In mild cases, pain may only be experienced when running. As it becomes more severe, pain may be experienced during normal daily activities or even at rest. In worse cases, the tendon becomes tender to the touch and visibly swollen. Pinching the tendon between the thumb and forefinger usually reproduces the pain. Reduce training. Back off on the types of workouts that put extra stress on the Achilles tendon, such as interval training and hill running. Faster, paced workouts, during which the foot is pushed harder against the ground, and running uphill, during which the foot is in a flexed position, activate the calves more, putting extra stress on the Achilles tendon. Ice. Fill a styrofoam cup with water and freeze it. Tear away some of the foam from the top so the ice protrudes. Massage the ice over the injured area using a circular motion for 10 minutes. Repeat 3 to 4 times per day. Massage. Rub the Achilles tendon between forefinger and thumb. Muscle strengthening. Strengthen the calf muscles, especially with eccentric training, during which the muscle fibers lengthen while they contract. Eccentric strength training promotes the formation of collagen, the main component of tendons, which strengthens the tendon. Get different shoes. If excessive overpronation is the cause of the Achilles tendonitis and tendinosis, shoes may need to be changed to ones that offer more medial support to prevent the foot from pronating. Plantar fasciitis. The plantar fascia is a band of connective tissue on the bottom of the foot that runs from the heel to the toes. It acts like a ligament that helps support the arch of the foot when running. Like Achilles tendinosis, plantar fasciitis is a degenerative condition in which the fascia on the bottom of the foot has become irritated. As a result of this degeneration, microscopic tears occur when the plantar fascia is overloaded, and it loses its ability to support the arch. Figure 6.4 Plantar fascia is a running technique and programming 202 cause. Is flat or high arched feet increasing mileage or speed training too quickly? Calf muscle weakness in the muscles of the sole of the foot. Symptoms with plantar fasciitis. Pain is felt on the heel or arch, but the pain usually occurs where the fascia meets the heel bone. The pain is often worse during the first few steps in the morning when getting out of bed or when getting up to walk after sitting for a long time. It usually decreases slightly when running and aches after the run. As the condition becomes more severe, the pain may be present all the time when walking or running. Treatment rest. As with most overuse injuries, back off on the volume and intensity of running. Strengthening and stretching the calf muscles. The calf muscles, along with the Achilles tendons, support the opposite side of the hinge joint from the plantar fascia. Exercise is for the sole of the foot. Roll foot over a small foam roller or golf or tennis ball for a few minutes at a time for a few times each day. Tension splint. Wear a splint overnight to hold the foot in a flexed position when sleeping. This stretches the fascia on the bottom of the foot. Shin splints. Shin splints are a common injury in new and inexperienced runners whose bones aren't yet used to the impact of running. Shin splints, officially called medial tibial stress syndrome, occur because the tibia, the larger of the two lower leg bones that bear your weight, is exposed to excessive shock to which it's initially unable to adapt. Although shin splints aren't a serious injury, if they're not properly treated, they may progress to the more serious injury of a stress fracture. Causes: increasing running mileage or intensity, too quickly running on hard surfaces, like concrete and asphalt. Excessive ankle pronation, excessively tight calf muscles, which can cause excessive pronation symptoms. As its medical name implies, pain is felt along the medial inner border of the tibia. The pain is usually dull and poorly localized and feels like someone has kicked you repeatedly. Treatment time: shin splints often heal on their own as the lower leg adapts to the stress of running. Ice: fill a styrofoam cup with water and freeze it. Tear away some of the foam from the top so the ice protrudes. Massage the ice over the injured area using a circular motion for 10 minutes. Repeat 3 to 4 times per day. Muscle strengthening: strengthen the muscles of the lower leg, including the calves and shin muscles. get different shoes. Shoes with sufficient shock, absorbing characteristics can reduce force, is on the lower legs and prevent repeat episodes of shin splints. Stress fractures a more serious progression from shin splints. A stress fracture is a hairline fracture in a bone caused by the bone being exposed to repeated stress. It occurs when either an abnormal stress is applied to a healthy bone or when a normal stress is applied to a weakened bone. Healthy bone adapts to both the stress of bearing weight and the stress of muscle forces. External stress is so important to bone health that the absence of stress by immobilization causes bone density to decrease by 1% per week. Bones need stress, just not too much of it applied too quickly. Running provides a great stress to bones. With running, bones get stronger through a process called bone remodeling. Like a fickle homeowner who can't decide whether to remodel the kitchen in English country or Art Deco, bones are constantly remodeling themselves. Bone cells called osteoclasts remove small areas of old bone, a process called resorption, and other cells called osteoblasts synthesize new bone in its place, a process called formation. This cyclic process of bone resorption and formation occurs throughout your life. A stress fracture occurs when there's an imbalance in the bone remodeling process, and the bone is unable to adequately adapt to the repetitive stress of running. Figure 6.6 Bone remodeling causes increasing running mileage, too quickly insufficient recovery between runs, low bone mineral density, which can be caused by osteoporosis or a calcium or vitamin D deficiency, low estrogen level. In women, estrogen protects bone and therefore plays a big part in women's bone health. Any condition that lowers estrogen level, such as irregular or absent menstrual cycles or menopause, is the risk of a stress fracture. Women with irregular menstrual cycles have 2 to 4 times the risk of a stress fracture than women with regular menstrual cycles. Not consuming enough calories. Women, even more so than men, need to consume enough calories to balance their caloric expenditure from running. When they don't consume enough calories, they can have problems with their menstrual cycles, which cause bones to become weaker. Lack of muscle mass in the lower leg. A major role of muscles is to absorb energy. With a small lower leg muscle mass, energy absorption is compromised, and women's bones absorb more of the stress when they run. Symptoms: stress fractures are classified as low risk and high risk based on the fracture site and their risk of complications. Most stress fractures in runners are low risk. The most common stress fracture site in runners is the medial inside or posterior back portion of the tibia bone. The next most common site is the metatarsal bones in the foot, especially the second, third, and fourth metatarsals. Stress fractures in the neck of the femur and pelvis are more common in female runners and carry a risk of serious complications if they're not properly treated. With a stress fracture, there is a gradual onset of pain that develops toward the end of a run. Stress fractures are characterized by a sharp pain at a specific point on the bone that can be felt when pressing on it. Sometimes swelling over the fracture site occurs. With continued running, the pain increases and starts earlier in the run. If left untreated, pain occurs with walking and even at rest. In the case of a femoral neck stress fracture, the pain is usually felt in the groin and is often confused with a groin strain. Treatment: stop running. Most stress fractures require 4 to 8 weeks of no running. Ice: fill a styrofoam cup with water and freeze it. Tear away some of the foam from the top so the ice protrudes. Massage the ice over the injured area using a circular motion for 10 minutes. Repeat 3 to 4 times per day. Muscle strengthening. Strengthen the muscle groups surrounding the joints above and below the fracture site. Chronic muscle strain. A chronic muscle strain, which is a partial tearing of the muscle, is the most common muscle injury in runners. Causes: excessive tension due to too much repetition or high force. Is muscle fatigue from long or high intensity workouts running long distance. Is weak muscle symptoms with a chronic muscle strain. There's a gradual onset of pain coming from deep within the muscle that usually comes on after running and then starts to become bothersome during running. The pain almost always occurs in a large muscle group, including the buttocks, hamstrings, groin, or calves. The severity of the pain depends on how much of the muscle has been torn. Pressing firmly into the affected area of the muscle feels like a hard knot and reproduces the pain. Treatment besides rest, only one treatment is effective for a chronic muscle strain: deep tissue massage, sometimes called cross-friction massage, applied to the painful area. Press very firmly with thumbs into the muscle and rub the thumbs in opposing directions. Because this maneuver hurts, ask someone else to apply cross-friction massage to the muscle or go to a physical therapist. Most chronic muscle strains respond rapidly to a few sessions of cross-friction massage.